Let's go now to President Trump's Surgeon General during his first term and the pandemic. Dr. Jerome Adams is with us. Sir, good morning to you. So before we get into the broader questions, let's start with that one. And I'll put the question to you as Senator Warner put it to the Secretary. Did the COVID-19 vaccine do anything to prevent additional deaths?
Well, I have no clue what Secretary Kennedy is talking about here because it's very clear that the COVID vaccine saved lives. If you just look at last year, 95% of the people who were hospitalized from COVID in the 23-24 winter season were unvaccinated. So speaking to you as a father, a doctor who still cares for patients, I was in the operating room yesterday, and a former U.S. Surgeon General. I'm deeply concerned about the health and safety of our nation under RFK's current leadership.
Well, let's get to that in just a moment because you co-authored an op-ed published this week in USA Today, accusing Secretary Kennedy of jeopardizing the integrity of the CDC and public health. This is with Doctors Jocelyn Elders, Richard Carmona. You wrote this: as former Surgeons General, we took an oath to protect the health of the American people. This includes speaking out when the public's health is in danger, even when doing so is uncomfortable or politically charged. We see that danger now in the current turmoil at the CDC. Here's the Secretary on the firings and the changes so far.
These changes were absolutely necessary adjustments to restore the agency to its role as the world's gold standard public health agency.
He says he's fixing it, not undermining it. You say what?
Well, the CDC isn't just a federal agency, it's a lifeline for millions of people. And he is, quite frankly, undermining it objectively. Objectively, we've seen organizations like the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, the American Medical Association, under Kennedy's leadership in the last 6 months, say that we can no longer trust the CDC, that we can no longer trust their recommendations. All of those groups have put out their own vaccine recommendations. And that shows you that he's not actually lifting up the CDC. He's pulling it down, he's destroying it, and he's putting lives at risk by doing so.
I want you to listen to Georgia Senator Raphael Warnock and what he had to say about the Secretary.
Hazard to the health of the American people. I think that you ought to resign. And if you don't resign, the President of the United States, who put forward Operation Warp Speed, which worked, should fire you.
He also said that he was a hazard to the health of Americans. Do you believe that the Secretary himself is a hazard to the health of Americans?
Well, I absolutely believe he is uniquely damaging the credibility of federal agencies like the CDC, NIH, FDA, and he's putting us at risk. And one of the most important things I want to highlight in the short time we have left is that we're using a dangerously narrow definition of high risk under this new FDA guidance that RFK put out for COVID vaccines, both public discourse and in our federal agencies. 3/4 of U.S. adults have one underlying condition like obesity, high blood pressure, or diabetes that significantly increases their risk of severe illness from COVID-19. And he's de-emphasizing limiting access to vaccines, which is going to disproportionately hurt communities of color who bear the brunt of these decisions. So to answer your question, not only is he endangering America at large, he's specifically endangering Black, Hispanic, and Native American communities who experienced death rates during the pandemic twice as high as white Americans.
Should he resign?
Well, he's not going to resign.
Should the president fire him?
Who we're talking to here is President Trump. And I'm just flabbergasted, to be honest, that he seems to have President Trump in a thrall. President Trump is clearly the leader on foreign policy, clearly the leader on the economy and tariffs. But when it comes to health, he's doing whatever RFK says. And it blows me away when I think about all that we accomplished with Operation Warp Speed. But I still am hopeful that President Trump will begin to see the danger that is being presented, not just to America, but to his own legacy by continuing to have RFK in this position, making these horrific decisions.
I've got one more question here, but before I get to that, should the president fire the Secretary?
I absolutely believe that he should, for the sake of the nation and the sake of his legacy.
Let me ask you here, the announcement from the Florida Surgeon General on the future of vaccination mandates in Florida. play it.
The Florida Department of Health, in partnership with the governor, is going to be working to end all vaccine mandates in Florida law. All of them. All of them. Every last one of them. Every last one of them is wrong and drips with disdain and slavery.
Vaccine mandates equated to slavery. What's your reaction to this proposal out of Florida?
Well, we know clearly that states with lower vaccination rates, which are often rural, under-resourced minority communities, have seen measles outbreaks reemerge in recent years. Again, saw negative outcomes from COVID, and this disproportionately affects communities with poor access to healthcare. So this decision is dangerous. It's not guided by the science, and again, it's going to hurt the least among us. What I would say to people in Florida right now is talk to your doctor. Talk to your pharmacist, talk to your nurse practitioner, because it's clear that you can't trust the people who are in charge from a governmental perspective to protect your health.